Hello everyone, welcome to my channel and welcome back with another video of teaching. And in this video we are going to talk about anti-arrhythmic drugs. But before you understand anti-arrhythmic drugs, you have to understand two charts, which is myocyte action potential and there is SA node action potential. So first we are going to learn about myocyte action potential. In myocyte, resting membrane potential is around minus 85 millivolt. So we are going to start with minus 85 millivolt. So this is our resting membrane potential. So this myocyte action potential is divided into 5 phases. So starting from phase 0, in which there is an influx of sodium inside the cell. It will go beyond the 0 point. So now we are going to move forward to phase 1, in which potassium channel will open and potassium will start coming out of the cell. So potassium channel will open and potassium will start coming out of the cell, which is called phase 1, in which potassium will come out. After that, elongated calcium channel will open and calcium will come inside the cells and potassium will keep coming out of the cell. So we will get something like this. This is our phase 2, in which we have calcium inside the cell and potassium is keep coming out. Okay. After that, we are going to move forward to phase 3. In this phase, potassium is keep coming out, but this calcium channel is closed now. So phase 3. In this, our calcium channel is closed, but potassium is keep coming out, and that's why membrane potential will fall. After that, our last phase, which is phase 4. In this phase, this is coming back to normal. Our resting membrane potential is achieved and this is our phase 4. So you have to remember this chart in order to understand anti-arrhythmic drugs. So you have to remember one more chart in order to understand anti-arrhythmic drugs, which is our SA node action potential. So SA and AV node action potential is also called pacemaker action potential. It is little bit different than myocyte action potential. So we are going to learn about that now. So this is our zero potential and this is our resting membrane potential, which is same for SA node and AV node. So we are going to start off with phases. So in this we have 3 phases, but these phases start from phase 4. So we are going to start with resting membrane potential, which is minus 85. So this is our resting membrane potential. So in SA node, sodium will start coming inside the cell very gradual way. So in this, sodium will come inside and this we will call phase 4. So this is slowly rising the membrane potential to minus 40 level. So this is our minus 40 millivolt. So after that, calcium will start coming inside the cell very rapidly. So we will have graph like this. So this is slowly rising and this is very rapid graph. So in first phase, which is our phase 4, sodium will start coming inside the cell very gradual way and calcium will start coming inside the cell very rapidly. And this rapid influx of the calcium will make the action potential above 0. Okay, so it will go on the plus side. So this is called our phase 0. In this, calcium will start coming inside the cell and this is very rapid. So after that, in phase 3rd, which is our phase 3, which is also called phase 3. In this phase, potassium will start coming out of the cell. And that's why our membrane potential will fall like this. In a gradual manner. So there are 3 phases: sodium influx, calcium influx and potassium outflux. And because of the sodium influx, there will be gradual rise in action potential, which is around minus 40 millivolt. And after that, rapid influx of the calcium will make the membrane potential more than 0. and after that calcium will start coming out of the cell and it will make the membrane potential fall, which is our resting membrane potential, which is minus 85 millivolt. So you have to understand these two graphs before you understand antiarrhythmic drugs. So why this rapid influx of the calcium is happening? Because this is our threshold. Beyond this point there will be rapid action potential. So main action of the antiarrhythmic drugs is to suppress arrhythmias. To suppress the arrhythmias. There are four types of the antiarrhythmic drugs. There are four types of antiarrhythmic drugs. First is class 1, class 2, class 3 and class 4. So class 1 drugs works on sodium channel. Class 3 drugs works on potassium channel. Class 3 drugs works on potassium channel, and these two blocks this channel. Rest of the class, which is our 2 and 4, works on SA and AV node conduction. Work on SA and AV node conduction. Okay, so class 1 works on Na channel, class 2 works on potassium channel, and class 2 and 4 works on SA node and AV node conduction. So now let's understand one by one. So we are gonna start off with class 1. Class 1 antiarrhythmic drugs which blocks the sodium channel. As all of you know, our chart that we have learned in the starting of the video, we have myocyte action potential looking like this. So this is our sodium influx. Okay, if we block this sodium channel, then this sodium influx will won't occur. If we block this sodium channel, this sodium influx will not occur, or you can say this will occur in a very slowly manner. It will look like this. So because of that, our QRS complex will widen. Our normal QRS looking like this, but after blocking the sodium channel, our QRS will look like this. So this is really wide QRS complex. So in class 1 there are three sub classification: 1A, 1B and 1C. Okay, in class 1 there are three sub classification, which is 1A, 1B and 1C. This is a classical example of 1A. This is the classical example of 1A in which we are moving this whole graph to the right side. So examples of class 1A antiarrhythmics are procanamide and quinidine. This is two classical example of 1A antiarrhythmic drugs. So now we are going to move forward to class 1B. So we are going to draw roughly like this. So this is our myocyte action potential. So class B drugs will be looking like this. So class 1B drugs will decrease the refractory period. This is our refractory period. As you can see that it will decrease the refractory period. So examples of class 1B drugs are lidocaine and mexiletine. So examples are lidocaine and mexiletine. So these are the classical example of class 1B drugs. So now we are going to move forward with class 1C. So we are going to draw first our rough chart. So class 1C will shift this graph like this. It will not affect this phase, it will affect more this phase. So in this we will have wider QRS complex. So this class 1C markedly widen the QRS complex. So the classical example of 1C is flecainide and propafenone. So this concludes our first class of antiarrhythmic drugs. Now we are going to move forward to class 3 drugs. As all of you know, what class 3 drugs does is that it will block the potassium channel. It will block the potassium channel. As usual, we are going to draw our rough chart like this. So what does this calcium channel blocker does? In this chart, calcium is working around in this area, okay? So this affects on this area only. So what it does is that, let me remove this. So what it does that it will block the calcium channel and it will make the graph look like this. This is very prolonged refractory period. This is very prolonged refractory period. So normal is like this and this is very prolonged, okay? So this is prolonged refractory period, and classical example of this class is amiodarone, sotalol and ibutylide. This classical drugs is for class 3 drugs. So now we are going to move forward with our class 2 drugs. As all of you know, it works on AV and SA node. So we are going to draw our rough chart and it looks like this. Okay. So this is our classical chart. So what class 2 drugs does is that it will decrease the slope like this. So it will decrease the slope and this membrane potential will take longer to reach -40 level, which is our threshold point. From this, calcium channel will open and it will rapid influx into the cell. And the classical example of class 2 drugs are our beta blockers. Beta blockers are metoprolol, propranolol, etc. Okay, so beta blocker work this way. So now our last class of drug is our class 4. These are our calcium channel blockers, and it works the same way on AV and SA node conduction. Okay, so we are going to start off with our rough chart. So this is our rough chart. So as you already know that calcium works on this part of the chart, It will rapid influx into the cell and make the cell depolarized. So obviously it will work on this part. So calcium channel blocker will make the chart look like this. It will prolong the depolarization. It was here, now it is here. So calcium channel works this way, and the examples of the calcium channel blocker are diltiazem and verapamil. Diltiazem and verapamil are the example of calcium channel blocker. So now we are going to see where you can use these antiarrhythmic drugs in your clinical scenario. So we are going to start off with class 1 drugs. As all of you know that it has sub-classification 1A, 1B and 1C. So we are going to see all of that. 1A used in atrial and ventricular arrhythmias and also in the supraventricular tachycardia. Class 1B used in acute ventricular arrhythmias, especially when it is induced by digitalis. So class 1C drugs we will use as last resort. When these two drugs won't work, we will use this drug. Okay, now we are going to move forward with class 2. As all of you know, class 2 are our beta blockers. and beta blockers we will use in rate control. If our heart rate is too high, then we can use this drug. So we will use as a rate control, like atrial fibrillation and flutter. In atrial fibrillation and flutter, we can use the beta blockers. So move forward with class 3 drugs. So class 3 drugs also we will use in atrial flutter and atrial fibrillation, and this is most often used drugs, which is amiodarone. So I have worked in cardiac hospital. So whenever patient used to present with atrial fibrillation, we used to give them amiodarone, which is 150 mg state IV. Okay, and if it doesn't resolve, then we will give 600 mg in infusion with slow rate. Okay, and this used to make the atrial fibrillation go away. So this is really important drug for atrial fibrillation. We used to give amiodarone in atrial fibrillation. Class 4 drugs, all of you know, it is calcium channel blockers, verapamil and diltiazem. So as I already told you that amiodarone we used to use in atrial fibrillation to control the atrial fibrillation. So after we control the atrial fibrillation, we have to give them drugs which work prophylactically, and that is our calcium channel blocker. So these also used in atrial fibrillation but as a prophylaxis, so that it won't occur again. So also used in atrial fibrillation. Okay, so these also used in atrial fibrillation. So that was all for antiarrhythmic drugs. If you like this video, then hit the like button and subscribe to this channel. And if you subscribe to this channel, it will give me immense motivation to make this kind of videos. And I would love to teach you guys in different topics. So make sure you hit the subscribe button. And thank you very much for watching.